She He currently serves as the Chief Operations Officer, the COO, at our doc, where she co-led the development of Nova GPT, Africa's first, I want you to listen to that, Africa's first multilingual AI health assistant and health marketplace, and scaled the platform to over 150,000 users across 25 countries. If you have hands, I think you should be clapping right now. This is not small at all. Dr. Joy is also a founder of My Paddy Doctor, an AI-powered telehealth startup for non-communicable diseases, and a research fellow whose work on AI-powered maternal mortality prediction and cancer recurrence modeling has been featured at major scientific conferences. She's the principal author of 8 articles in renowned journals. A multi-award-winning innovator, she has been recognized as one of Africa's top 10 exceptional professionals in healthcare, an emerging leader in AI by Black in AI, Next Generation Female Leader, and Best Health Tech Innovator, Impact Africa Summit. Beyond innovation, she has led 20 plus outreach programs delivering free cancer and maternal health screening to underserved communities. She has spoken on 30 plus global stages and has been featured by major media houses such as BBC, Al Jazeera, Channels, and Arise TV. Her mission is simple yet profound: to harness technology not just to cure diseases, but to predict, understand, and prevent them. Right now, at this moment, with a clap innovation and with happy emojis, let us welcome Dr. Joy as she takes the lead this evening and ushers us into an amazing segment of the training tonight. Welcome, Dr. Joy. Please, you can take the stage. Um, okay, sorry, Dr. Joy. Let me try to work on that.
Hello, everyone. Can you confirm if you can hear me now?
Yes, we can hear you now. Thank you very much.
All right, great. Good evening, everyone. It's always a pleasure um, to meet and speak with the Unbox Med team. You all have a very special place in my heart because I'm always inspired myself by, I mean, healthcare professionals, undergraduates, really across the spectrum of healthcare professionals that are deliberately working to improve their not just clinical experience, but to ensure that they optimize themselves for the current AI innovation or even the current AI ecosystem at this point in time. So thank you very much for having me. Today's I want to call it more of a discussion because I feel like um we have had very technical sections for the last few days. And the first part of what I want to do is to even get feedback from 1 or 2%. What is it that you have learned? What is it that where are you at with your AI journey and what you're seeking to gain from this interaction today? My goal here is simple. I'm supposed to talk about how to actually build prototypes using artificial intelligence for healthcare challenges. But I really want to understand why. So, why did you register for this? What have you learned so far? And what do you plan to learn from this session? So, if I can get 1, 2 persons to quickly respond to that, and then we'll get into my session. So, you can just raise your hand if you want to speak, and then I think the team can unmute you, and then you go ahead. So, do I have any takers? All right, I see a hand up. Clinton, you can go ahead and speak.
Good evening, ma. Good evening, all. Can you hear me, please?
Yes, please, I can hear you.
Okay, so good evening. I'm grateful for this opportunity to actually be here. Throughout from the first day till now has been so mind blowing. Even the technical aspect, I could relate to it very much because I just became a newly inducted doctor, and I'm also a developer. I've been actually following our doc. Our doc has really inspired me and my team to also come up with our own platform, Heart Africa. So we've been trying to understand how to make healthcare solutions to be very simplistic. And over the course of this program, I've actually learned how to build something that can actually be very simple but yet understandable to the African community. Because we've been researching based on big companies that have come around and have fallen, people like 54 Gene and all of that. So it has been kind of scary in the sense that these are people that actually came up with solutions that could actually revolutionize healthcare in Africa, but yet ended up falling. But then we have our doc that have stayed and have built to over 150,000 across Africa. So it has really challenged us as a team because my team here in Heart Africa, we've actually been following the journey. It has not been easy, but this has really helped us to, to plan further, to scale further, to actually go back to the drawing board and see what exactly do we need to do to actually contribute to African healthcare sector. So I'm really, really grateful so far from the beginning of this program to now. So that's little I can say. Thank you.
Thank you very much. That was definitely really great. I like the fact that you had certain goals in mind and that the fact that you're already building. So first of all, congratulations. I mean, new doctor on the block, clock it. Um, Congratulations on that. And to see that you are already building, like I was having a conversation with Nonso some few weeks ago, and we're just thinking about if we had all of the resources and um opportunities that are available right now. If we had that like 4 years ago, like our medical journey and our lives would have been significantly different. So to see all of you with the access you have with artificial intelligence, I mean, what a time to be alive. So well done on what you have been able to build so far. Any other person before we go ahead? I am not sure. Okay, I don't think there's any other person. I'm not sure if anyone um raised up their hand in the comment section. Okay, so we're just gonna go ahead. My next question will then be, what do we understand by prototypes? So if you have built something, again, I like to be very conversational. So this is not literally going to be a presentation where I'm going to come and talk and talk and talk. I feel like you have had that throughout the week, and there's no point to have like one long conversation or one heavy deck and go. Oh, although I have a deck, but I want this to be as conversational as possible. So what do we understand by prototypes in general, or medical prototypes, or building those prototypes? So you can type a response, or you can just raise up your hand and so prototypes are the first sample of already made products for testing. Yeah, that's correct to an extent. But yeah, any other ideas?
Yeah,
Um,
yeah, I think prototype are like MVPs of a
mhm,
product, if I'm saying it correctly. Like the first test, like a trial test to be
mhm.
used before the final product is out, if I'm correct. I don't.
Don't worry, there are no right or wrong answers. Thank you very much, Favor, for that response. I see someone said they are basically test samples of a thing, a sample mock-up to show how the product may look or work. Excellent, excellent. I love that. I have a very excellent audience today. So yeah, that's really what prototypes are. Prototypes are you saying, I have this idea in my head, I kind of know, I don't I know what I want to build. So with that understanding of what I want to build, I would create a sample of what that should look like or what that can look like. And that's what prototypes are. And the goal of building prototypes is that they move you from a position of ideation to conceptualization, where you actually start to build that idea. But there's an entire chain of action that happens before we get to prototype. So I see that error a lot where people have an idea and the next thing you're hearing, oh, we are launching, or oh, we have set up a team and we are going live in 30 days. And I'm like, okay, impressive, nice. I mean, I love the enthusiasm, but there's an entire spectrum of activities that should happen before we even build a prototype as to the why or the how or what that prototype should look like. And the goal of my presentation today will be trying to walk us through that process of actually building a prototype and what that prototype should look like and what it shouldn't look like. What's because again, we are in, I don't want to say the era of artificial intelligence, but it's literally an era. That is what it is. Because we are in the era of artificial intelligence, it's so easy for us to, I mean, we are now skipping the part of critical thinking. And I see that a lot across spectrum. So aside our doc, I work in management consulting, where I basically lead high-stake projects, so foreign funded projects that are implemented across Africa. And recently I completed a project with the Gates Foundation where we developed an ICT system for emergency service management. And then I see this error a lot. I see this decline. So, I mean, as part of management consulting, you have like different cadres of management consulting. So you have fellows, you have analysts, you have senior analysts, and the core of management consulting is critical thinking. It's simply your ability to say, this is the idea, how do we implement that idea? But with the advent of artificial intelligence, the problem I see a lot is that we now see an entire crop or an entire generation of people who are skipping the aspect of critical thinking and are just moving into conceptualization or actual building projects or developing solution. So the goal of this conversation will be, what should be your train of thoughts? Yes, I have the idea. Yes, there are problems in health. Oh, my hospital has this problem. Medical school has this issue. I have this bright and shiny issue. Oh, women are dying of cancer. People are dying of this, and beautiful, nice. But how do you realistically move that idea to a prototype, an MVP, an actual product that can make money? And just to allude to what Clinton said, we have seen the rise and fall of so many healthcare organizations where they had this bright and shiny idea and they came and it was a lot of noise, but there was no consistency. And it's kind of like in tech, we call it pilotitis, where we have a lot of pilots and they just die as pilots because, again, there was no thought process behind continuity and sustainability. And that's what I want to implement because, honestly, I feel like anyone can go into Claude or ChatGPT or Codex or Co-work and say, build me a prototype for a maternal mortality app. And it will do that in less than an hour. Like technical skills, unlike 5 years ago or 3 years ago, are not bright and shiny. There's nothing cool about being a software developer in my books today because anyone can code up an app in 30 minutes. What would sustain the kind of talents that are now being treasured or the kind of talents that would remain relevant in the next 5 years are people who have critical thinking, people who are able to direct artificial intelligence, people who can guide implementation of artificial intelligence. And that's the goal of what I want to achieve today. I feel like I've spent 20 minutes to explain what I want to do and I've not started doing it. But are we on the same page? Do we have understanding of where we are at now? Like thumbs up, emojis. I like to interact, so it's not be like I'm just rambling away. So do we have context as to the why or why this is even important and why this should be our first step? I feel like I am blocking the slide. Give me a minute. I feel like this will block my slide as I go ahead. Let me see if I can do this. Confirm that you can see my slide.
Yes.
You can, Abby? Okay, so I just realized that this blocks a significant part of it, so I'm just going to take this down. So this is really what I have been going on about for the last few minutes. So just successful innovations starts with there is a healthcare problem worth solving, and the goal of this conversation would be, how do we identify real healthcare problems? Because I can tell you some healthcare problems are very abstract, and some of them are human, I don't want to say human induced challenges, but there are problems that if you solve operational issues, they will definitely go again. We want to evaluate whether AI is actually needed to solve certain problems, because again, because everybody's shouting AI, literally every solution now is saying, oh, we have AI algorithm or AI enabled or AI something. AI. Let me stop saying AI. I have a lot of AI to see it. Let me save it. Anyways, we will try to build and design a solution, walk you through how you can do that, build a prototype roadmap, and then learn how to pitch your ideas, which is very important, because I've seen so many people with bright and shiny ideas, but they didn't know how to pitch themselves properly. So African healthcare reality, the problems that we face. One, everybody knows this, there's a workplace and workforce shortage. I mean, we have what, one doctor to about 90,000 people in Nigeria currently, and WHO recommendation is 1 to 600. So there is a problem. There's an access problem where there's problem of distance, there's problem of cost, waiting times, that prevents timely care. There's also the problem of information gap, which we have not, which is a major barrier that we have not totally given as much attention to as we should, because you can develop all of the artificial intelligence tool, and if people refuse to use them, major problem. So there's a health literacy problem that actually delays diagnosis and even worsens outcome. We have fragmented health care systems where primary healthcare center is doing their own, tertiary is doing their own, secondary is doing their own, laboratories and diagnosis are doing their own, and there's no internal communication within these different organizations. There is also a data challenge where we see poor documentation, so limited support tools for decision making. We don't have, I mean, less than 20% of healthcare facilities across Nigeria or even across Africa currently use a EMR system, and we're talking about artificial intelligence. The next question, I mean, I feel like if I ask 2-3 people, which of these problems keep you up at night for a medical, or I think the challenge, no, the question will be, which of these problems do you think is worth solving first? Or which should we focus on first? So should we focus on the access problem? Should we focus on the information problem? Should we focus on the health shortage problem? Or should we focus on the data problem? At the top of your head, if you were to solve one African problem, where do you think we should start from? Yeah, okay. Let me go to the chat session. So I'm seeing work shortage is paramount. Okay, shortage, data, information, access, information, access. Okay, looks like information and access are winning. It's a good thing. My good friend, also coming tomorrow, a good doctor. He would, I mean, he has basically hacked health information and communication and is doing an amazing work. And the goal is to see more people in that session. Information, literacy, data challenge. Good. I like that. I like the way we are thinking, and we will answer that question together as we go along. So just hold that thoughts. Again, the goal of this is critical thinking. I want you to come to a place where you're able to hold an idea and think through the entire spectrum till you move from idea to conceptualization. So AI is not the solution. Let me just bust your head to the African and Nigerian problem. So let's even start from there. AI is not the solution to the African healthcare challenge. All of our challenges, AI is not going to solve it. So if you're coming here thinking I was gonna tell you that all the solutions to our problems are gonna be solved because we have AI, sorry to bust your bubble, that's not gonna happen. And it's really pretty straightforward. AI is a means to an end. It's a tool. It's I don't like to call it an experiment. It's not even a bubble because it's here to stay and it is here to stay with us, except there's some circumstantial change that can alter things in the next 4 or 5 years. The trajectory of our lives has already changed, in case you have not caught up. Who you are, what you'll be in the next 5 years, who you work with, how you work, everything. The trajectory of our lives has already changed because of AI. So FYI, in case you don't know. Yeah. So saying waking up one day and say, oh, my hospital needs a AI chatbot. The actual problem of or how you should be thinking about it is to say we have women in rural community who miss antenatal care due to poor follow-up, or even due to health literacy problem, or due to social cultural challenges that stops them in accessing health, or even due to lack of finances. And then you say, how can AI help to solve that problem? So instead of waking up saying, I want to build a maternal mortality triad system, what you should say is there's a maternal health challenge. In which of the spectrum of this maternal health challenge can AI optimize the problem, not solve the problem? Does that make sense? I hope that makes sense to you. So what I want to introduce to you is design thinking for healthcare. Basically, design thinking is your ability to think about health, to think about solution as a spectrum and not standalone offshoots. So with design thinking, the first thing you say is you empathize. So you say to yourself, who is suffering in this challenge? So there's a who in the problem solving. You then define the problem to say what exactly is the problem. And that's where we now feel as healthcare professionals, because we're very blindsided to the problems of healthcare. The danger of a single story, like Chimamanda will say, is that we see a problem as one thing alone, and it stops us from seeing it as any other thing. Healthcare personnel, we have a very singular perspective in health. So if they ask you as a doctor, what do you think is the problem? And they ask a nurse and they ask a laboratory, three of you will probably have different perspectives. So when you want to say what exactly is the problem, you don't say what is my problem. You think about it as an organization to say, as this entire organization and also the people, what is the exact problem? And the way to know people's problems is to ask them, ask your patients what they think the exact challenge is. That's how you solve it. Again, the reason why a lot of health organizations do not scale is because they are solving problems that nobody sent them to solve. Just to FYI, half of the health tech solutions that are on the market, nobody sent you people to build what they have built there. And that's why they are not sustainable. That's why they are not scalable. That's why people do not invest in healthcare, because everybody's building telemedicine. And now our doctor has built chatbots, everybody's building chatbots. And the next, everybody will start building marketplace. Then everybody will not start doing multilingual. Relax. I'm sorry. This is how I have conversation. This is supposed to be a conversation. So I'm having a conversation with people. Again, because I don't want us to make the same mistakes that are already being made. The best way to know the problem is to actually ask people. Again, managing consult is very funny because it's ridiculous what people pay you to do. Like they pay you to think on their behalf. And then when you start to think, and they will now use a lot of English, like we'll use English to sandpaper it and package it. Sometimes when we work on certain like policy documents and strategy documents, I go home laughing because I just spent the last like 45 minutes just speaking English with big grammar. And at the end of the day, what I want to do is that I want to develop questionnaire and share it to all the women in your community. And when they answer that question, I'll go and do data analysis and I'll come out to one bright and shiny solution and I'll not sprinkle AI enabled. And you're like, wow, you're not giving plenty money to go and solve it. And I'm like, you realize you could have just asked the population what their challenge is. Am I making sense? Like, are you getting the why and how to solve problems in healthcare? So really, half the time, what is people's problem? No, we started from who is suffering. Who is suffering? How do we solve that problem? Sorry, give me a minute. All right, sorry about that. The next thing is that you want to ideate. You want to say, okay, now that I know the who is suffering, the next thing I want to do is that I want to ask myself how, or what are the possible ways in which I can solve this problem. So what are the possible solutions? I know that there's okay, people are missing antenatal care. I now know why they are missing the antenatal care. Their husbands are not allowing them to go. Their grandmother, their mother-in-law say they have to deliver at home. They have to deliver like Hebrew women. They don't have money to pay for antenatal. When they come to antenatal, to get to antenatal, they have to enter 4 buses and they'll pay 500 naira for each of them. That's 2,000 naira. When they get to the hospital, the nurses are rude. They'll waste their time. Then they'll spend 2 hours. 2 hours they should have used to cook for their husband. When the doctor sees them, the doctor is rude and the doctor will just press and tell them to be going. These are all problems. Your next step is now, which of this problem is the most important thing that I need to solve for now? Which of these problems, if I solve it, I can change the entire, again, spectrum? Or am I able to prioritize to say problem A, problem B, problem C? Priority list, I'll solve problem A, which will lead to problem B, and then problem C and D and all of that. That's how you should think about your solution. The next thing you want to say is, how do I build an quote unquote MVP? The simplest solution technically that can solve this problem. If you hack this, you have hacked project management, clinical product management, and management consultant. Like, if you're able to, if I don't even teach you any other thing, this thing I'm teaching you, it's like freebie. Take it anywhere. You would walk into a room and people would think, oh my God, you're so smart, so intelligent. It's just common, okay, it's not common sense, it's critical thinking. Just again. So what do I build that is simple enough, cost effective, cost efficient enough, and effective to solve the problem? When I build that, how do I then test it? I test it on the same population. I don't take that solution and take it to another population and say, oh, test it for me. I take it to the same people who complain to me about their problems. And I say, oh, I built this thing. I think it can help you. Test it. I test it and I take their feedback. And I take their feedback back, optimize it, and I give it back to them. And let me tell you what this will solve. This will mean that you have, one, customers with a pain point, customers that need your solution, customers that will pay for your solution. You have done all of this with simply an idea. You have not really, I'll say quote unquote, spent a lot of money, but you already have people that are ready to pay for your product. Again, that is the secret to business continuity and sustainability. So when people say, oh, how are you guys able to get over 150 people and even more? Like, this is us reducing the number so it doesn't seem outrageous. How are you able to get people that are consistently paying? When people say, oh, people don't pay for health, people don't subscribe to healthcare thing, how are you able to get people that are not only interested, paying, interacting every day with this? They are made this like their point of access or their point of care for everything health related. This is simply it. We knew there was a problem. We assumed there was a problem. We went to the people, we taught her the problem, asked them the question. We now decided what is one thing that we can solve that can change it. We went back to them and said, oh, test this thing. They're like, I love it. And we said, okay, come and give me money. And they gave us money. The end. Okay, not the end. But yeah, that's really the thought process of design thinking. And that is how you think about problems in health. That is how you solve for problems in health. Because again, when you want to solve for health problems, because health problems are multifaceted. So health problems have appendages. That's how I like to describe it. They have like, health has it's not a standalone issue. It is a how do I explain it? Oh, sorry. I need to give me a second to plug my laptop. But I'll still be speaking. Health problems are they're weird to solve because you can't solve for health problems in isolation. You have to solve for health problems in continuity, because one health problem, you talk about health, and then you talk about finances, you talk about, because I mean, you realize that I talked about socio-economical problems. So there's a culture of telling women, oh, you should not go from you should not leave the house without your husband agreeing to you leaving the house. That is a religion and social-cultural problem. If we want to solve for that, that means we have to speak to religious leaders. That's another entire sector. Women trying to get to the healthcare facility, that is a transport problem. So to solve for that, you have to interact with the Ministry of Health to say, how are we building roads for our people? That's why health problems are very complex, and it seems like they're hard to solve, because sometimes we underestimate how convoluted health problems are, and we try to solve them in isolation. So I hope this helps to give you context. So before you even think of building anything, how you're supposed to think about building that thing. So next, I would then go into healthcare problem definition framework. So I mean, this is a very easy way, like a canvas, like a problem statement canvas you can use. Again, I'm laughing about this is because for people who, I mean, are thinking of healthcare leadership and administrations and management, really, these are kind of what they do on a day-to-day basis. And they seem like, oh my God, they're so cool. Like they're doing amazing things. This is really what we do. All those are English that we're speaking. It's just English. This is literally what we are doing on a daily basis. We're thinking of who is affected, what is the problem, why does it happen, what's the impact of that problem, what existing what currently exists, why is it not sufficient to solve that problem. A practical example is what I already used, like the ANC problem that I talked about, and I then say, and the part of the clause I then want to add is that the last part of it now, because we are talking in terms of artificial intelligence, your last question would then be saying, can AI solve this problem? The problem most people do is that they say AI can solve the problem. Remember how we started to say, oh, AI will solve the problem, instead of saying what is the problem and the opportunities for AI. So when you have done this entire design thinking, your next step is say, okay, this solution that I want to build, is this something artificial intelligence can solve? Again, the fact that there's an artificial intelligence boom does not mean that every healthcare problem will be solved by artificial intelligence. Sometimes your behavior is just bad. The nurse is just a mean human being. You as a doctor, you are just lazy. That's the problem. The problem sometimes is that somebody somewhere is not pressing the computer they are supposed to press. And that's why the hospital, that's why they take you. So it's not everything that here AI will solve. There's the part of artificial intelligence, there's the part of Internet of Things, there's the part of your behavior is just bad, which is a conversation for another day. Let's not go there. Yeah. So how to know when AI is appropriate? So AI works best when there's one, pattern recognition, decision support, customization or personalization, language transmission, and automation. And I need us to understand this in very good details, because this will save you a lot of time when you're thinking about artificial intelligence solution. The core of artificial intelligence in health is pattern recognition. So what artificial intelligence does is that it takes a large chunk of data, it understands the pattern in that data, and then it uses that understanding of that pattern to then prospect. Simple thing. Give me a hospital history of over 100 patients that have been diagnosed with breast cancer. What artificial intelligence will do is that it will sit through all that data and understand the pattern. It will say, what was the age of all of these women who came there with cancer? Then it says, okay, there's a pattern here. Women in their 50s who had a history of smoking, maybe had a sister, an auntie, a mother that had breast cancer as well, had 1, 2, or 3 risk factors, then eventually came down with breast cancer. So it takes that information to say, this is the scale in which breast cancer can occur. Whenever I am then exposed to a new patient and then I see a mammogram, because of the pattern recognition I now have, I'm able to prospect and predict if this new woman, based on her history and her imaging, can have breast cancer. That is what artificial intelligence is doing. Again, I feel like I'm here to, I was supposed to come and tell you technical things and show you nice and funny things, but I'm just here to bust your bubble to tell you like it's not as technical as you're thinking about it. It's actually very simple. It's very easy. That's what AI, all this AI and Claude and all these things that we're shouting, that's what it simply does. It's pattern recognition. And that's why it's so cool and it's so good for healthcare, because all we do in healthcare is pattern recognition. Your entire medical school, how many years that you used to learn anatomy and physiology and all of these things that you were trying to understand what is a normal human being like. What is pathology is saying, okay, what is a abnormality? What does abnormality look like? You're clicking, all you're doing in your clicking is that you are trying to say, this is what is normal. This is what this person is telling me. What are the probabilities or the list of probabilities that could be wrong with you? And that's what AI does. And that's why it works so well with healthcare. Another position or where you should be thinking about AI as a solution is decision support, to say, is this a situation in which artificial intelligence can help me to make better decisions? And I would like to pause here to add a clause to say that in healthcare, we are currently all of the AI guidelines, AI governance guidelines, the strategy documents, there is a clause that says the ultimate decision when it comes to health, who gives the final veto decision, is a healthcare personnel, which is why, as of today, don't say I'm the one that said it, AI cannot fully take the jobs in healthcare because of how critical decision making is. You still need that human insight to look at the evidence, to look at information for artificial intelligence, and look at the patients in front of them and make the final decision. Another place where you can think about solutions artificial intelligence can help with will be personalization and customization, to say, because now healthcare is moving towards precision. Yes, precision medicine, that's what it's called. To say, how do we develop health solutions that are tailored to individual, not population? That is why it seems like public health is going extinct, because public health talks about populations, understanding populations as a whole. Precision medicine is saying, how do we understand individuals and develop and say, if ibuprofen will work for me, it doesn't necessarily mean it will work for Prosper. And if diclofenac works for Prosper, it doesn't necessarily mean that it will work for Uche. How do we critically understand individuals as a whole and develop management and develop treatment modalities for each of them? Again, how do you do that? Data, pattern recognition. Language translation is what we see around, where we have, AI that can then speak local languages. Again, to bust your bubble, we have tried it all so that a lot of healthcare organizations will not have to go through it. They are on the market currently. There is no one singular tool that with an 80% confidence translates to local Nigerian languages. There are a lot of them. They do fairly well, but they do well with controlled data. So where they succeed is ability to translate and transcribe for, in controlled situations. There's no, how do I explain this? Very controlled situations where there's no noise, there's no interaction, there's no destruction, there's no noise, basically. That's where the translations and transcription work out. But take people to the market and ask them to speak Hausa and use one of these tools and they convert it to English. It struggles to do that. That is it. This is me giving a solution for anybody that wants to think of helping us to solve that. Then this part of automation. What AI is often unnecessary for simple rule-based logic. So our day-to-day patient conversation that needs human input, human empathy. You have tried to have a conversation with ChatGPT. How did that go? As it's scratching my screen. Don't do it. As nice and smart as intelligent as ChatGPT is, it lacks human empathy. It's still very robotic. It's trying its best to sound it will still say, thank you very much for sharing that with me. Would you like me to? It's always there. It will always be there. So because healthcare is built again on empathy, connection, communication, those kind of things should not be outsourced to artificial intelligence, at least for now. Because some of you people, your behavior is bad. You do not have empathy. You do not have empathy. This is intermittent break. Have empathy, my healthcare professionals. Don't be the weapon fashion against your patients. If I say AI will not replace me, but your behavior is bad, people will rather listen to AI bots than listen to you because that. Let's be nice. Okay? Good. Moving on. And then high risk autonomy decisions. So, I mean, let's say life or death. We are in a critical situation to determine, are we going into surgery or are we not going to surgery? Do we, I mean, like patients with multiple failures, oh, do we save the baby or do we save the mother? Or, oh, do we start with the heart or do we start with the liver? Those high stake decisions will always would not be, should not, I will not say will not, should not be outsourced to artificial intelligence. So high potential for AI opportunities in healthcare. Like I mentioned, at least maternal mortality is it's our front, it's at our face, it's killing people every day. And because again, there's a lot of pattern, there's a lot of data, they are already existing. We are pretty much aware of what the challenges are. We know the who, we know the what, we know somehow the how. It's easy to use or it's easy to leverage artificial intelligence to build prototypes for maternal mortality. Another part is NCDs, hypertension, diabetes. 1 in 3 Nigerian, African. As we're on this corner, if we do roll call, 1, 2, 3, 1, 2, 3, 1 in 3 person has diabetes or has hypertension. So it is a problem. And again, it fits the criteria of what artificial intelligence can solve. Diagnostics, so symptoms triad, clinical triad, like what we do at our doc, easy to solve. Prototypes, easy to build as well. Lab, so interpretation. Actually, this is like the top of the list for artificial intelligence because there are certain organizations currently in the US that have completely outsourced their diagnostics to artificial intelligence. MedGamma, for example, is confidently housing and taking over radiography used to be like, oh, these are the cool guys in medicine. But now, literally, there are hospitals in the United States that have said, over the next 6 months, we are going to sack every radiologist and radiographer and replace them with MedGamma because it's doing the work for us. It sees a test, it interprets it in second, it prospects, it predicts. So why do we need you to use 5 days to interpret CT for us? Again, people's behavior in healthcare is bad because why are you using 6 days to interpret CT? I will tell you that your behavior is bad. Now they'll use AI and replace all of you. Why are you using 7 days to interpret MRI? But I've been warning you. See that now AI will take our job because our behavior is not good. I'm sorry. I'm being very playful today, but yeah. Do change your behavior so that AI will not take your job. If we do not hear, now you see. Anyways, another part is workplace support. So, clinical decision support, like using health AI across the entire spectrum, and that's the prototype that I would actually show. Again, that prototype. Okay, when we get there, I'll talk about it. So the entire spectrum of healthcare. So from the first place of saying, oh, how do we collect a patient, all that time where you be asking family history, or thinking, I've asked family history now. Should I ask medical history? Did I ask him if he smoke? Did I ask him if he drink? AI can actually support you. So the moment this person says, my name is this one, it tells you, oh, ask presenting complaint. After presenting complaint, it's, oh, probe further. Oh, ask of this one, ask associated system, ask associated symptoms and all of that. That's what like clinical decision support does. Another part is public health outbreak surveillance. So it's able to predict, to say, like all of these DR, Congo, and Ebola every 2 market days. artificial intelligence system can say, oh, based on ABCD, we can predict that there will be an outbreak in so place, so time, and then we start to prospect and prevent. Well, I want to say prevent for it, but again, just let me be nice. Evil behavior in this Africa is you people are stubborn. Even if they predict and say Ebola is coming, some of you will still go and eat rats. Some of you will still go and hunt. Some of you are the weapon fashion against ourselves. Some of you will not let us succeed. Please, let us take it. Because is it just me? Let's use 10 minutes to this. Why is it that every time we have outbreak of anything, is that DR Congo? As Africans, we need to come together. We need to collaborate and sanction that country. They are the weapon fashioning every time. Go and look at it. Ebola, DR Congo. And what's the other one that is every time? Monkey. Today they eat monkey. Tomorrow they eat bat. Now this one that is happening, they went to go and put fire on the quarantine house, all because they wanted to collect the person that died. So now they've collected a dead body, exposed more people to the pandemic. I don't know, it's not pandemic yet. Exposed more people to the Ebola. So all those people that came in contact with that body now, suspected cases. Some of them that were in that place now, they've run away. They have gone to spread it like they are spreading love. You see, this how we AI solve this problem. Not it. Anyways, back to being professional. These are the issues. I don't know how to help you people. Anyways, we're done with our commercial break. I'm done ranting. Let's get back to business. So prototype walkthrough. So what I would try to do now is to kind of walk us through. So this prototype that we have been talking about, how do we actually build that prototype on how, and I'll use, for this example, I'll use like the maternal mortality because I've already been using that. So I'll just continue with that. So again, the problem, the solution, the function. That's how you think about building a prototype. Again, do not focus as you are building. So sometimes we get carried away about the functionalities and we forget the problem that we're trying to solve. So let's take, how do I explain this? So yes, we want to build an app that will help people to not miss their antenatal care. And then the app is just complex. The start button is in one place. You have to maybe use biometrics, or you have to double click or censor something. And you are forgetting that the people I'm developing this problem for are women in the village that have not finished eating, they have not bought folic acid to give their baby. Then you have now gone to build app that only works on iOS. For who? For who? These are the issues. So whenever we're thinking about the functions of how that app or that prototype we build, always have in mind, like at the forehead, say, this is a problem, this is who I'm building it for, this is how I'm trying to solve for it. So every function, I have to think, is this something that this particular people can use? So in this instance, the functions would be ANC reminders, danger sign warning, health education, and referrals. Again, remember that the goal of a prototype or MVP is simplicity. So the simplest format possible, but the one that is what cost efficient and operationally effective. So it will give us a lot of outputs, but it is the most cost effective way of effective way of going about it. So designing the user journey. So the user says, oh, I have a headache and a swollen foot. That's what the human will put in the chatbot, for example. AI would then ask her, how many weeks pregnant are you? Are the other symptoms? So is there any bleeding? Is there blurry eyes? AI then detects the weeks and then it recommends a solution to say, oh, based off on this, you're already 30 something weeks pregnant, you're having blurry vision, you're having headache, your feet are swollen. This is a sign of an emergency. This woman might be having hypertension in pregnancy. So this is not the time to start saying, oh, do not worry, or oh, relax, or oh, go to your community. This is an emergency. So it flags it. it flags it an emergency and says, oh yeah, quickly go to the go to a healthcare facility. And that's how you think about solutions. So very simplistic. It should move patients quickly from their problem to the solution in seconds. That's how you think of building a walkway, building the workflow for a prototype. So again, because we are in the era of artificial intelligence, I don't think anyone, no, I don't think you shouldn't. I don't want to conflict myself. Let me think about this, how I want to say it properly. When you want to build a prototype, an MVP, depending again on the strength of your team, a lot of people here are literally people still in medical school or just coming out of medical or early career personnel. Think again of the easiest way, leverage existing solutions. So instead of saying, oh, we're going to hard code the entire app, the entire MVP, ask yourself, are there things that I can do without coding that can solve my problem and give me a working MVP in the next few days? So think about AI assistants that you can use. There's Codex, there is Cloud Code. There are so many on the market that you can actually use to help you move quickly through the entire spectrum instead of sitting down on GitHub for ages and weeks and months. I'm not going to go into technical things because I feel like there are some people on this call now. If they say we should do technical things, they will go band for band. They will even kick me out of my work, and I'm trying to keep my job. You get me? I'm trying to keep my job. Anyways, so think of low-end solutions that you can use, preferably non-code solutions that you can use to help build that prototype. Think about app builders. There's Lovable is like the name is lovable. It's very lovable to me. The things I have done with Lovable and Hugging Face, I can never let go of those. They're always open on my laptop. Anytime, any little things, I go to Hugging Face. Somebody has built it on Hugging Face. That thing that you're trying to build from scratch, FYI, somebody has built. Just go to Hugging Face. Search there. You don't need to go too far. Love, someone has built. Go to Lovable. The next thing, you have an entire prototype. You see, life is not hard. Life is not hard again. Except that it's a bit hard. But anyways, so these are me just running through options that you can think of, and it gives you a prototype. I said in days here, but literally in hours you can get a prototype. It's not that bad. So now we'll now move. I have been speaking for about 30 minutes or more. Okay, we should wrap this in the next 15 minutes. How do we then move from the prototype to the actual product? So what makes a prototype successful? This is where a lot of people fail. So I feel like if your product is, if you should know that your product will be successful by this time. So it's a bit rainy. If you can't hear me at any point in time, please say so, because it's raining and network might become a bit unstable. So confirm if you can still hear me at this time. Can anyone hear me?
Yes, yes, we can hear you.
I'm for safety sake, I'm just trying to move to another network, just to be on the safe side. So confirm that you can hear me. Thumbs up, anyone? Okay, great. So I feel like before you even get to this part, you probably already know if your solution is going to be successful because you have thought about the problem. Like before you bring
Hello everyone, can you hear me? Can you hear me? All right, so it seems like there has been a break in transmission from Dr. Joy. I guess her network got a bit bad. However, I'm sure she was loving the
Can
environment
you guys
and
hear me?
she's back. Thank you. Yes, we can hear you.
Okay. I assumed the light has gone off, so it was connected to um the router, so that has gone off as well. But confirm that you can hear me and see my screen.
Yes, we can hear you and we can see your screen as well.
Perfect. So I'm going to run through this so that I get time to ask a lot allow people to ask questions. So how do you know your prototype is going to be successful? By now you're sure that it solves a simple problem. It has a very simple user flow. Again, because we are building for Africans in Africans, you want to explore a solution that works offline or has a very low bandwidth to say, oh, how much data do people need to solve this problem, or how much data do people need to access the tool? Again, I will always advocate for tools that you can actually use offline. Again, you have to think about something that is culturally appropriate. And this is so important. I see a lot of people solving problems and they do not think about context. They do not think about, oh, I'm solving this for people who are actually Muslims. Is this halal? Is this something a girl or an adolescent girl in, cultural sensitive organizations will be able to use? So these are the things that you have to think about. You also have to think about, is this scalable? This idea that I'm building or I'm trying to build for, is it scalable? Will it be here in the next, will it continue to be able to solve a problem in the next 5, in the next 6 years? What makes it fail is you're thinking about, again, I see a lot of people thinking about technology first or technology above solution. They're ignoring the user's context. So users are saying, oh, this is actually my user journey. This is actually how I access help. And you're saying, oh, no, we can't do that. It has to be tech savvy. We want it to be agentic. We want it to be all of this. And you ignore the people who are actually using this application. Another thing is that it's too complex. If I have to press 7 buttons before I'm able to speak to a doctor, you have already lost me. Again, we're dealing with a generation that does not have an attention span. People are swiping, like contents that somebody will use 10 hours to shoot. People will just sit and swipe. This is me just telling that for all of you that sees Nonso's video, Akpodoko's video, and you swipe, God is watching you because you don't know the investments that it takes to shoot all of those videos. Again, this is literally the generation that we live with. So when you're building a solution, you have to be asking yourself, how quickly can I hold and grab people's attention and keep them using this application? Literally. Next, you want to be thinking about, you want to be saying, oh, is this clinical validation, which is very important to say, oh, how do I validate the outcomes from this? So it's not, you don't stop at the point that, oh, I've built an app, oh, it's working, and people like it, oh, they're willing to pay it. Where is the point where you are validating the outcomes from this application to say, oh, this app says, like this patient said, oh, I'm pregnant, I'm running a temperature, oh, I'm pregnant, I'm having headache. What was the outcome that your tool gave to them? And I feel like a lot of healthcare organizations do not take this into cognizance. We don't have like a post solution pathway to say, how are we constantly reviewing the outcomes that we get from this application? Do we have a point where we're having quality assurance to say, oh, in the last 10 months, these are the answers that this AI bot has given, who is reading, who is reading it, who is saying, oh, is it accurate? Are we even sure that it's not hallucinating? So all of these are things that you have to take into context. So define your problem statement, validate it with real users, build a simple prototype, steps, test, iterate, and then, as always, seek not just mentorship, seek guidance. So now you have built a solution, you have a prototype. How do you actually get people to fund that idea, which is the problem, a major bottleneck that most health organizations, was a panelist and mentor in the Harvard Health System Innovation Lab hackathon. It started since this March, and just in the Ogun State Hub, there were over 56 teams, if I'm correct, that had mind-blowing ideas. Like the solutions were mind-blowing. Different teams, different people with ideas, with solution. All of them are what at the end of the day looking for funding. And it actually just made me feel sad in a way, because it feels like we have a lot of ideas as Africans. We kind of have a way of knowing how to solve it, but they're just little. There's funding, but it doesn't come to help. Like someone can just wake up and say, oh, they're building one fintech something and one crypto something, and you see them raising ridiculous amounts of money. And it feels like healthcare, where we're actually solving the major problems, we are not getting that kind of financial investment. So I will not, this is not a public health or what like say, a public speaking or how to pitch your idea. But again, because I've had to sit, like the most common messages I get are, Dr. Joy, I'm building the solution. We're looking for funding, or I want you to mentor me and train me and all of that. The problem I keep on seeing is people with ideas and no revenue. Like you don't have a clear path as to how you're going to make money. And let me just break it to you. What investors are looking for, and this could be angel investors, this could be venture capital investors, anyone that's going to give you money, the only thing on their head is, how are you going to make me money? So instead of coming here to teach you, how to pitch your idea, how to make the perfect pitch deck, let me not lie to you, that they are not listening to other. And because we're in Africa, we approach, again, because we're coming from healthcare, we approach pitching to investors as an impact summit. So we are telling them, 500 and something women, that they don't care. Let me just, but that sad story that you're about to say, they don't give, that's what, I don't give a damn, yeah. That's what they are saying. Sorry to say. I'm becoming a clown again. They don't really give them about that sad story and how your uncle or auntie died of cancer. That's why you want to now save the world. At the top of the head, they are thinking, okay, this thing that you do, who is paying for it and how am I going to make money? So I need you to, instead of taking all of your time to tell you, how do you build innovation? What I would tell you is to build financial education or financial acumen. How do you realistically build a model, a business model that would make money? And how are you able to communicate that? That's the solution. There is money, there's funding, there are VCs everywhere, but how do you realistically, and that's not something I can teach you in 5 minutes or 10 minutes. You actually have to do the work of understanding business and business model and technology financing and how you do all of the math and how you understand who is your target market and your SAM and your TAM. Again, with working in this field has come a lot of stretching and a lot of knowledge. You see the things ridiculous things that I've had to read and learn just to be profitable and sustainable. So I will not tell you that, this is something you can learn easily. You have to do the hard work of learning how to run a business and how to make money. So the easiest way to pitch for innovation is simple. Tell people a problem, tell them a solution, the money you're going to make for them, the impact that money will make in the market, and your business model. Your pitch deck should not be more than 10 pages. This is the problem. This is how I want to solve the problem. This is how I'm going to make the money. This is the impact that money will make. The end. If you want to be flashy, throw in your team structure to tell them, this is the team I want to build that with. Sometimes it works. But that was even why I put 2 options up there. So sometimes you want to tell them team evidence and all that. Or sometimes they don't really care. Do you have a doctor there? Nice, cool. Do you have someone that knows how to code? Nice, cool. Do you have what they call it? someone that's a product or whatever. So instead of bothering yourself on how to build the perfect pick deck, as healthcare professionals, if I was in another setting, I'll give them another advice what we should be learning, because they don't teach us this in medical school or in health or any of the health courses. Learn how to communicate financial benefits to investors. So, final takeaway, don't build AI. Sadly, that's what you came to hear. Learn how to build solutions, and then say in these solutions, what are the opportunity for artificial intelligence? Understand the problem, understand the user, decide if AI is necessary, build a simple prototype, test, and then iterate, 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 iterate. I will show you a simple prototype. Again, this took minutes in Claude. And this is an entire prototype that we used to get a grant, which is a clinical decision support. So that we're able to build, and they were, trust me, mind blowing. Like, oh my god, this is so amazing! Wow, your tech team must have spent decades trying to build this. I was like, yeah, it took us a lot of time, but actually, this took me a few minutes on plot. Again, prompt engineering will change your life. That is not a conversation or something I can go through this, but prompt engineering will change your life. I see a lot of people using artificial intelligence very dumbly, which is not great. Before you use Claude, actually sit down. They have an entire course where they actually teach you how to use the app for your own benefits. Even the free version, you'll be amazed the amazing things that you can build, but that's not the conversation for today. So this is a simple prototype that is simply showing what a clinical decision support tool can look like on the patient's side of things. There is another one that talks about chronic care and how we manage chronic care and how community pharmacies can see this at the end. It's an entire presentation. I can't go through the entire thing, but I'm just kind of showing you like really cool things that you can build with prototypes, and then you can build this in second, and this is your entire, so this shows the entire patient work through what the patient will see, their daily reading, medications, check-ins. It shows like a health score. Again, I have very good understanding to build this. My prompt was very detailed. I was able to say, this is the problem, this is how I want it to look, this is what this should be, and all of that. This another tab, and this is, it's actually interactive because it gives you like the HTML link, and then you can actually navigate this entire. So it feels like it's already a website on its own, but again, it's just Claude. This is like the daily schedule, 30 days adherence of the patient, refill, all of that. This shows their readings, this shows their appointments. Very simple thing, but very detailed to show you, oh, this is how a clinical decision support tool look like. On the management and pharmaceutical part of things, this is what they'll say. So they're filling their patients if information, is part of vital symptoms. There's a part of stat triage where they actually classify their patients into different grades. So based on their symptoms, it's able to stratify those patients into different groups, and then monitor them going forward. So it's not a website, let me not lie. It looks like it's a website, but it's not. It's just a normal HTML link. I have a domain, so I can actually push this to a domain, and it's an entire, this is a prototype. Other English that I've been speaking this morning. This is how you can build it. So, with a few points of mine, I hope I'll be able to convince you and not confuse you. The AI is cool and is nice, but in healthcare, your critical thinking, design thinking, your ability to see a problem at a spectrum and not a standalone situation, and then critically solve it using design thinking, then decide if AI, if it's something AI can solve or cannot solve, will make you a lot of money and give you a lot of funding. Thanks, and God bless. Over to you, Uche.
My God, this this is amazing. Dr. Joy, you exceeded our expectations, man. Like it was just all fun and vibes. Like we were learning, we were enjoying the lecture. Dr. Joy, I beg, I will come make I Make I take lessons. Make you teach me the way, teach me the ways. Teach me the ways. And let's just, appreciate Dr. Joy, say a few words of appreciation on the chat box and use emojis to say thank you and thank you and thank you. I'm sure you have questions. Dr. Joy has time for a few questions, and so um, I think you should be able to unmute your mic. So raise your hands, and then when you're called upon, you unmute your mic and then ask your question as Dr. Joy attempts to answer them, please.
So I would just should I just call people as I see the names?
Okay, yes, you can. But Dr. Joy, I'm not so. I still be your boy. You final year medical students, but yes,
Yeah,
you
my
can call.
Oga, please. Yeah, my Oga. Okay, I can see. Sorry, I'm trying to go back to favor. Okay, that's the first one. So I'll just go the way it's arranged on my screen. That's fine, right? So favor, please go ahead. Favor, if you can hear me, please go ahead. Okay, I don't think favor can. Can anyone hear me? Let me make sure
Mute.
it's
Oh, sorry, I was having a problem with the speaker, be the
all
unmuting.
right. That's fine. Go ahead.
So, Dr. Joy, thank you for the amazing section. It was truly amazing and sweet today. Thank you for your time. So, my question was that I heard you said about um how will I put it, the MVP part, how you give out survey to people that really need the app you are building or software. So the thing I'm trying to ask is that what of if you have insufficient information about what you are trying to build? Maybe you give out 50 50 survey plan and only 10 people answer. How do you go about the uh, other data to get the amount of information you're looking for? Because last year I had this particular problem. I was trying to build an app for my classmates because we are medical students. We are having problem with booking an appointment with our student clinic. So I was trying to build an app for them. I gave out survey. Some people filled it, some people did not. Some gave insufficient information. Some just went to the last part and submitted, and that made me unable to win the grant I was trying to win because
Okay. So let me tell you this. This the simplest way to get information from people as so you have to understand um how do I say this? Huh. Understand the people you're trying to get information from. If I want to get information from medical students because I know they are busy and they will not solve their question, what I will do is that I will go to class and say, give me 5 minutes of your time. Everybody sit down. I will literally read out the questions in the questionnaire and get five of us to say, take notes. So five of us are taking notes and say, hey, what's the problem? What do you think is the problem? They give me the answer. So focus group discussions or key informal interviews. Think about what works best for your population. So if you are giving questionnaires and it's not working, ask yourself, why is it not working? Is it because they are because I mean medical students, nobody's feeling that survey. And I literally did this few days ago. So again, I work in management consulting. An organization is trying to again AI. They want to incorporate artificial intelligence into their organization, and they had all these big and shiny ideas. And I simply asked them, "Well, what is the challenge of your staff? What do they complain every day about it?" And they're like, "They're not very sure." And I'm just like, "So why do you want to solve a problem with AI when you don't?"
Okay, I guess there was an issue with her network again. However, let's just give her some minutes for her to put things in order and get back. In the meantime, kindly note that the attendance has been shared on the chat box. I know that the messages on the chat box are many. However, find the attendance and right. I'll keep sharing it frequently. So please do that. It's very, very important for you to fill the attendance so you wouldn't miss out. It would be very sad if you weren't able to um okay, Dr. Joy, I'll do that now.
Hello, can you hear me?
Yes, we can hear you now.
Okay, great. My other device is about to go off, so I'm just gonna move on here. But basically, what I was trying to say is that find the best way to actually get information from people. If focus group discussion, if like interviews and surveys are not working for them because they are busy people, get all of them in one space and ask them those questions and get the answers that you need. That's the best way to go about it. I hope that provides the clarity that you need. I don't have the list. Give me a minute. Let me see. So Clinton, Clinton. Then I see after Clinton, then Franklin, and then Chiamaka.
Clinton,
Hello,
go
ma.
Clinton,
ahead.
yes, go ahead. Thank you.
Thank you so much, ma. I really learned a lot. Ma, I don't know if you can remember, I think you did a program last year in July where I talked
Okay.
about this South Africa I mentioned, if you can remember. So it's what we have been moving about since I just became a doctor now. So with most of them, all the things you talked about, how to even pitch, we actually did a lot of that because part of our team, though our team we are more of in short, our team is made up of full health professionals. We have pharmacists, we have other doctors like me, we have nurses, a lot. And funny enough, most of us are the developers too. So, but one thing we're actually we're in a lot of grants competitions. But one thing that we've been trying to decipher is we have the solution, we have the problem. By the way, what we're building about, like I said, Heart Africa when I respond initially. So it's just basically an AI cardio risk assessment that can predict possibility of coming down with heart disease, and at the same time we help to monitor medications patients are taking on to help them give them the time meant to take it, and then they're able to respond that they've taken it, or if they've not taken it, the both at the end of the day will ask questions that what happened, how can we help, and then we also put OCR for food recognition where you can snap the meals you're eating on WhatsApp and then gives you the nutrition context, and then it responds like it's heart safe, it's not heart safe, things like that. And then we also have where, yeah, after running your risk assessment, you can print out a PDF, show it to a doctor who understands, and then he can respond. So we have all of this going. We've been doing our beta testing since December last year till now. We're about to launch fully. But now the issue now that we are having now is how do we now get this into the market, into the world? Like I've been CTO of other tech companies like crypto companies, and then it's quite easy to market. Like once you just do small ad, people just want to come on board because it's crypto, it's finance. So I want to ask, like, how can we push a health tech solution to the masses, particularly those in rural areas, to make sure that to show them that this solution is out. This is very easy for you to access. I mean, it's low bandwidth. How can we like make this popular to people around Nigeria, to Africa, at like what I'm just trying to ask is what strategies do we use to market this effectively? That's what I just want to ask.
Okay. You can come and pay me for marketing consultation. Don't worry, I will not bill you. I'm joking. But yeah, you can come and pay me. Oh, it's very simple. So because you've already built, it's if you kind of follow the steps that I kind of explained by now, that will not be a question because you already have a market that kind of needs your products and are ready to pay for it. But since you have built already, your target market, who are the people that need this application the most? A simple way to do it is to get a pilot or to conduct a pilot. Get 50, 50 persons that are going to use the application for the next 4 months. And it could be a cross section. So it could be people who have cardiovascular disease already, people who do not have any cardiovascular disease, people who, so a spectrum of, let's say, in their 60s to as low as 18, get a good size and then monitor, let them use this application. That's the best way. You then come back to the world to say, we built this, we tested it on 50 people, this is the outcome. One person did not even know they had any form of cardiovascular risk. They were just walking around, and through our application, they were able to find out that, oh, they were at risk for this, they were at risk for that, or they even had an existing cardiovascular anomaly through our application. Storytelling. You get 5 people to make a nice video, and they are telling all the stories about how they saved their life and almost, I mean, they were going to have a cardiac arrest and all of those cute things and all of those storytelling. That is your market. You're already marketing your product. You have people that have now used it, that are now interested in telling other people about it. Because we are living in Africa, the best way to market product is peer to peer. So having people tell other people about it. I know that again, a major advantage of us at our doc is that there was Aprico doc, so and it's popular. But honestly, what has kept it sustainable is people telling other people about it. So a daughter uses it and then she tells her mother, I use this thing and it helped me to do it. Mama, you to use it. So that's the solution of how you can do it. Another way is to think of this as a specialized tool. So are they standalone organization that provide cardiovascular solutions? Pitch this to them to say, we have built a cardiovascular risk assessment. Do you want to add this as one of the solutions in your organization? Do you want every first or every new patient that comes into your facility to use this first of all? So these are ways that you can think about it. Again, should I bust your head? AI is your friend. You see this, your idea, you see everything that you have told me, take it to Claude and tell it, this is my problem, this is what I'm thinking, and this is the bottleneck I am. Come up with a go-to-market strategy and leave it to Claude. You will be amazed what it will develop for you. Give it all of the context that it needs. Tell it the population is in Nigeria. This is who we are. This is what we are. I can bet it. You'll be amazed the solution it will give you. And then contextualize this. And I mean, it's not hard like that. But yeah, I think you have a really great product and there's already a market that needs it. You just need to know the how and why of how to make that happen. Thank you. Chiamaka and then Chidera. Chiamaka Emmanuel, that's the name. If you can hear me, please go ahead and speak. I know that we are running out of time. Can anyone hear
Okay,
Chiamaka?
hello, good evening.
Hi,
Good
good
evening,
evening.
everyone. Yes, thank you so much, Dr. Joy. This session was really insightful and I learned a lot. My question is, well, I've been talking about AI, but when you talked about the problems we face in Africa, like the healthcare sector, when you talked about information gaps, when we talked about the low health literacy, I think that is a huge problem we have in Africa. If you go to PHCs in rural communities, your mind is going to be blown because I've been hearing, "Oh, we need to build this, we need to build that," but we're talking about communities where you hardly even see them maybe with a smartphone. You hardly see them, they have so many weird beliefs. I've heard a woman say, and the reason why she refused to bring her child for immunization, the routine immunization, is that she feels like all these vaccines will make her child have one, deformity or whatever. I've seen things. I've heard when you hear a woman talking about her mother-in-law did not allow her to come for ANC because she does not believe in all those things. In her own time, she do all that. So my question is, how are we going to cope this problem? Because is can I say it's a pandemic? It's a huge problem. And if you notice, yes, we have the country is really developing now in Nigeria. Yes, things are getting better. Most areas are getting more civilized. But there's still some places where they don't have this so-called internet. They don't have means of reaching AI and the rest. So what is the solution to this problem? Because sometimes these communities, they have the facilities. Some of them have doctors. Some of them have nurses. But yet the people, they refuse to go to their PHCs. So how do you encourage these people to understand the importance of seeking healthcare? Thank you.
Okay, so I think you're actually all of us, we're all in this together. That's why I said decide the problem that AI can solve and decide the ones that need other solutions. Some problems are health literacy problems, so we need more healthcare professionals on the internet telling them to change their behavior. That's simply how you solve that. Some problems are policy challenges and funding challenges. AI cannot solve that problem, so we need more people who would be in positions of power and politics so that they can actually clamor for more. So I'm a very realistic person, so I'll not come here and tell you aspire to acquire so that we can maguire out of our problems. I'll actually tell you the logical way. I don't have the answer to that question. I can't tell you how we solve all of those problems. I can simply tell you these are the problems and these are the viable ways that we can solve them. So, how do we solve the multifaceted challenges in health? Is for we need people in those different facets that are solving for those problems. So in health communication, we need more people in health communication. In policy and legislation, we need more people in policy and legislation. In primary health care centers, we actually need people who will not only work as, because we have CHUs, we have junior CHUs. Ideally, medical personnel have no business. Like a medical doctor, quote unquote, ideally should not be in a primary healthcare center. That's why we have community healthcare workers and junior community healthcare workers, and we have that entire spectrum of healthcare professionals who are supposed to be assigned to the community healthcare to the communities. And what the reason they are called community healthcare workers is that their responsibility is not in the PHC. Their responsibilities is moving in the community and telling people to come and access health. If you read the policy documents that actually guide all of this, again, if you do public health and all of that, and have actually access to Nigeria's Health Act and you read all of it, your head will be paining you. You'll be having headache for like 10 days when you actually see the proper job description of what people are supposed to be doing. So this part of, illiteracy, poor health penetration, they are supposed to be a crop of healthcare workers that are attacking that problem. There's the one of, like roads now. How do I solve that problem with AI? Like, bust my head. There's no road here, nothing that I can do. There's the part of skill-based attendants that are in communities taking deliveries. How do I solve that problem? The only way I can solve it is to say, okay, now that you're a skill-based attendant, you were not properly trained, how do I help you become a better skill-based attendant? Because till next year, people will still go to these women because they have the trust of the community. People trust them to take their deliveries. So sadly, I don't have a solution to the problem. I can only say that we need more hands in the different aspects. We can't fool ourselves that AI will solve all of our problems. They're actually logistical problems, operational challenges, and the solution is just really people who are passionate enough to solve all of this problem. You can be one of them. So lead the campaign, Chamaka. We dare your back. All right. Chidera Emmanuel, I think that's the last hand up. Chidera Emmanuel, if you can hear me, please go ahead to ask a question. I'm looking through the chats to see if there are any questions I might have mixed.
Good evening.
Good evening.
How are you? My name is Chidera, and I'm a medical student. So I have a question.
Yeah, I'm
I get
struggling to hear you. It's breaking a lot.
okay. I said I have a question. I don't know if you can hear me clearly now.
Okay, now it's better. Go ahead.
So I have a question. I guess Jonathan has asked a part of my question. So for let me put it in this scenario. You and your management team are tasked to reach people, let's say, for example, pregnant women, and now you're asked to reach out to them, and you have what we call, you already said it while you were giving a presentation, you have a language barrier as a problem. And your second problem is you notice that the people around have a low attention span. So, and there's a cultural placement where they understand the effect of sleep. They understand the effect of maybe not taking their folic acid or not taking antenatal, but then they don't know how to display to their, let me put, autocratic husband. So how are you going to, or what are your plans like you can put in place, you and your team? What plans can you guys put in place to make them effectively work this out? I don't know if you understand my question.
I don't know if I introduce myself as Jesus in this meeting because when I don't they ask me question. We only Jesus fit solve. Anyways, ah, there's an answer that I want to give you. And so again, I'll solve this problem by asking you the question back. So if I hear you, it's a challenge. There's a language barrier challenge. Yes. Chidera, can you hear me? I'm not sure if Chidera can hear me, but I'll go ahead. So if I hear you properly, you said there's a language barrier challenge. There is a there's the part where the people that want to access this care cannot access them because they are fundamental things. So social, cultural, religious reasons.
Sorry, no, my mic was muted. Sorry,
Okay,
but
that's
yeah,
fine. So no, I was just trying to make sure I have context of the entire scope of your question. So I said you're trying to help a group of people and there's a language barrier challenge, right?
yes, no,
Then there's the problem where there are social, cultural, and religious barriers that stop them from accessing that your solution, right?
no.
Then what other parts of the problem is there?
The low attention span
Okay,
and
low attention span. Again, you see all of these problems. So design thinking. Look for one that you can start to solve for. Attention span is a problem that, I mean, all of us on this call now, if you open Instagram and the person is talking for more than 5 seconds, you have swiped, you've gone. Can I solve that problem? Can you solve that problem? Yeah, it's a yes and use nice hooks and make the content grabbing, have nice intros. It works to an extent, but you cannot use nice hooks when you're seeing people physically. Will you come and jump in their front? You know the way people used to jump into all of those videos and say 5 things you need to know about cancer. You cannot do that one physically. They'll beat you and drive you away. So try to solve for the problem, but ultimately it is a how do I say it? It is a psychological personal journey that you have very little to no influence on. It's like trying to solve attention span for a decent generation. How do you want to go about that, especially with health content? So, trying to remember, there's a particular creator that does a lot of how. I'm trying to remember the person. Stop coming to my head. I mean, don't go far. Go to Nonso's videos and look at all the intros of his videos and say, how is he able to grab the attention of people in very few seconds? And how can I create content that is able to do that? That's one way to think about it. The problem of language barrier, get a translator. Now we have automated tools. Again, it's actually a problem we're trying to solve for in our doc, where we're trying to look for a cost-effective transcription and translation tool. Most of the ones on the market say they are good, they have got funding and grants, but in the actual sense, they're not giving us the kind of output that we need. So for other languages, it works well. Nigerian and African, we're still, I mean, there's Intron Health, there's Sabian, there is Help Mom, trying to remember who else is built for transcription and translation, but explore that. For sociocultural things, the best way to do it is to engage with community healthcare personnel. So religious leaders, their imam, their pastor, the community health leaders, and tell them your wives are dying, people are dying. We have a solution that can help them. We want them to come to the hospital to monitor their pregnancy and continue advocacy, continue advocacy, continue advocacy. It's so advocacy in their kingdom come. till their kingdom come. You have to keep talking and keep advocating. A major challenge I see with healthcare professionals, because we think health solutions are we think about them linearly. So we say, oh, I identify the problem and I tell you to stop this, and then they don't stop, so we are failed. That's not how it works. You have to keep on reinforcing and speaking and speaking and speaking. So keep speaking to the women directly, keep speaking to their husbands, keep speaking to the community healthcare leaders, keep speaking to their religious leaders, keep speaking to the faculties that they trust. If you're able to break through those faculties that they trust, then you are able to somewhat gain their own trust. So they trust their pastors, they trust their imams. So if their imams are then coming to church to say every woman should go for the antenatal, they say, my pastor is saying this, that means that it actually works. So again, I'm not Jesus. Some of the problems only Jesus can save us. That's the solution that I have in mind. Thank you.
All right. Thank you, Dr. Joy. Ah, it has really been amazing so far. Thank you for coming on board. Thank you for sharing your wealth of knowledge with us. And once again, thank you for being so welcoming, humorous, and so friendly, really. If my lecturers for med school they teach me like this, God knows I go get all the distinctions we have to get for this school. But no,
Even
they
though,
should
if you
adopt your style. So thank you once again. To everyone who was able to join the call this evening, please remember that it's necessary that you fill the attendance link. The link is in the chat box. Once again, I'll share it so that we will not have issues. And we are going to do, okay, you have a question. Can we take more questions? Also take note of our doc link in the chat box. Dr. Prosper has shared it so that you can get acquainted with what our doc is doing and also use the tool and see how practically AI is solving these problems that we've been discussing. So I encourage you, click on our doc link and check it out. Okay, so for the question that you have, Dr. Joy, can you still take one more question?
Yeah, let me take that. I have
Okay.
8 o'clock, so I just have like 10 minutes. So yeah, let's
So this is the
let's take
last
that
question that
question.
Dr. Joy will be answering. So I saw someone who says, so Flora Wemaitha, please can you unmute yourself and ask your question? Flora. We'll take it and then we can call it tonight. You're muted, you can.
Okay, I have a question.
Go ahead, please.
Okay. I wanted to ask for, does anyone has an idea of what someone can build relating to public health? Like what one can build to assist in public health workers?
That's the question, right? Hello, can everyone hear
Yes, Dr.
me?
Joy. Yes, that's the question.
Okay, public health, a lot of things, a lot of solutions. Because public health is a bit broad, it will help if you can, how do I say, it will help if you can customize or niche down. So pick a particular niche and then solve for it. Again, public health deals with population. So understanding of populations, understanding of disease trajectory in those population, and then solving for those challenges. Again, I think I gave a very simple example, which is prediction. I feel like that's the easiest way to solve in public health is prediction. So to say, what is the current trend in a particular disease? How can I understand that pattern? And then how can I take that information and predict that disease happening again, so that I take that information to not just the government, but to multilateral organizations to say, based off on the data of A, B, C, D, I think this disease will happen in this population because of A, B, C, D. So can we put measures in place to prevent it? For example, even the current Ebola outbreak and a number of outbreak, all of these diseases, they have a pattern. There are circumstances and situations in which they occur. So what predictive analysis will do is to help you to predict that. And I'll give you a simple example of what one of the first tools I built when I was making my transition into artificial intelligence. It was a predictive analytic tool. And basically what it was able to do is to predict the recurrence of thyroid cancer. And it was very simple. I basically had a data set that had over 100 people who had been diagnosed with thyroid cancer. It had the results of their investigations. It had their treatment plan that they were put on, and also had their post chemotherapy or post surgery outcomes. So what they did over the next 10 years after they were diagnosed, and then who are the people that then came down with thyroid cancer afterwards. So whenever that particular machine learning model is then exposed to a new population, it's able to say, oh, based on my understanding of data and how thyroid cancer occurs and how it reoccurs, I can tell you that this particular patient would have thyroid cancer. And not only thyroid cancer, he will have a recurrence. What the doctor then does with that information is that says, okay, how do I then build a treatment modality for this patient such that, one, I'm preventing thyroid cancer from even happening, and if it has happened, how do I manage it in a way that it does not reoccur? Again, precision medicine. So these are kind of just the ways that what they call artificial intelligence can work with public health. The simplest way, my darling, go to ChatGPT and go to Claude and ask them this question. You have a barrage of answers and you'll be at loss as to where to start from. Again, the best way, customize it. So don't just go and say, ChatGPT, what are the problems in public health? And it will just give you a random answer that does not have any form of context. So maybe give a context of your background, give a context of a problem that you're particularly interested in, or give context of population, or say, oh, in Port Harcourt, for example, we have environmental challenges, blah, 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 blah. What are the public health problems I should be seeking to solve in the next 5 years? Who are the organizations that are currently funding for this kind of problem? Who are the people I can write grants to and I can apply? Now I'm giving you a business idea. I mean, I know release all my secrets, but yeah, thanks.
Thank you very much, Dr. Joy. Thank you very much. We are grateful that you could find the time to come around. Thank you once again. Unboxmed is really grateful to you, Dr. Joy. This is the second time you've shown up for us physically in our programs, and I know you've shown up for us many times behind the scenes too. Prosper tells us a lot of stories, a lot of things you've been able to do for us, making all these things we do really work, and we are grateful. Thank you very, very much. Also, once again, to everyone who could come around this evening, it's your boy. Okay, no,
I
let me
am
not end.
so sorry. I wanted to so on the 12th, I'm going to give Prosper this information. I said I was going to say it, but then I forgot. I'm going to be hosting a webinar on the 12th. It has been a long time coming. Again, my most valuable currency is my time, because unfortunately for me, I'm a very busy person. And so this has been a recurrent ask. How do I actually make a transition into artificial intelligence? How was I able to make my transition? Even if I want to remain a doctor, how do I remain a doctor? Or how do I remain a nurse or a healthcare professional and still do artificial intelligence? Again, this request has been like my most frequently asked questions. So I'm going to be doing a webinar where I actually walk you through my journey, the how, the what, the where, and actually practical steps that people can start to use today, not even tomorrow, to actually critically make that transition. I would share all of the information with Prosper, and I'm sure you guys have a community or group chat. So whenever you see that, please do well to register. If my EA says it's going to be free, it's going to be free. but the way she's moving, she might say it's not free. But I always have a soft spot for Unboxmed, so I would definitely share the information once we have concluded on the date. I will share it with Prosper so you guys have like first leg into it and all of that. I am also going to be sharing. So I've worked with a couple of resources. There's actually a digital product that can actually help. I basically compress all of my experiences, logical ways, and who and how you should actually make that transition. I would also be having a community that's going to start in July, strictly for people who are just serious and making that transition in the next 6 months. And we're going to have actually an accelerator program. So 3 major things I and my team has been working on, but I knew that this like the number one place. So again, once all of it is confirmed, I would actually tell Prosper to put it out there before it goes up on social media. So once you see that information for him, please click it. Get in before they close the door. Again, I don't have power over these things because the people that are managing me, they're stronger than me. But yeah, I just wanted to add that. Thank you very much.
All right. Thank you very, very much, Ma. We are grateful. Also, I want to announce to everyone, please, it's going to be amazing tomorrow again. Just like we've seen this evening, Aproko Doctor is going to be here. Dr. Chinomso Egemba is going to be here with us tomorrow, sharing his own insights regarding AI and everything. And so we are going to be doing another campaign, massive campaign, so that we can get more people, tell our friends, and let them know that it's going to be amazing. And tomorrow's session is going to be in the morning, not in the evening as we've been having all along. You know, we have gotten an opportunity for him to be here, and the time he would have for us would be in the morning. We'll share more information on the group chat. But once again, thank you everyone for coming this night. Dr. Joy, once again, thank you very much and have a nice evening. All right, guys, it's been nice with you. Take care and good night. Make sure you fill the attendance form rather.
Very far away, but when I'm with you, it's like a holiday. You're my safe space. Oh, I hope you know. I hope you know. I hope you know. Only you, only you, only you make me feel a special kind of way. Mọ̀ pé ìwọ láyọ̀fẹ́ mi. Promise me you will ride with me until the end. Bino banjo, Jojo Barra. Promise me you will ride with me until the end. Zion is very far away, but when I'm with you, it's like a holiday. You're my safe space. Oh, I hope you know. I hope you know. I'll be there even if I don't get money. Makule, makwesa tira money. Don't love me, don't buy me, pay by me, should do coco. Boya money moto, I can never leave you solo. Oh no, oh Lord, yeah, me go want to spoil my sequel. Oh, 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 yeah, me need photo the way you love me so you need me calling me bozo. I can't for you, no need show you. Oh no, oh Lord, yeah, me go want to spoil my sequel. Baby, you are my one